Understanding hemorrhagic fevers. A look at Ebola. Hemorrhagic fevers are a group of serious illnesses. They are caused by several distinct viruses. Ebola is one of the deadliest. This virus attacks the body swiftly. The Ebola virus damages blood vessels. It also disrupts the body's ability to clot blood. This leads to internal and external bleeding. The virus spreads through direct contact with bodily fluids. Symptoms of Ebola typically appear within 2 to 21 days of exposure. Fever, headache, muscle pain, and fatigue are common initial symptoms. These can quickly progress to vomiting, diarrhea, and unexplained bruising or bleeding. Early diagnosis and treatment are crucial for improving chances of survival. If you suspect exposure to Ebola, immediate isolation and medical attention are critical. Prompt action can save lives. Combating Ebola, supportive care, and emerging treatments. Currently, there is no cure for Ebola. However, treatment primarily focuses on managing symptoms and complications. This is known as supportive care. Supportive care includes providing intravenous fluids to combat dehydration. Oxygen therapy helps with breathing difficulties. Blood transfusions may be necessary to address severe blood loss. Antibiotics are used to treat secondary bacterial infections. In recent years, there have been promising developments in experimental treatments for Ebola. Antiviral drugs like remdesivir and monoclonal antibodies have shown some efficacy in clinical trials. These medications work by targeting the virus itself. Additionally, an Ebola vaccine has been developed and proven effective in preventing infection. Vaccination efforts are crucial in controlling outbreaks and protecting healthcare workers on the front lines. Preventing the spread, protective measures and environmental control. Preventing the spread of Ebola requires a multifaceted approach, emphasizing both personal protection and environmental control measures. These measures are essential in containing outbreaks. Personal protection involves avoiding direct contact with the bodily fluids of infected individuals. This includes wearing appropriate personal protective equipment, like gloves, masks, gowns, and eye protection. Proper hand hygiene is crucial, with frequent hand washing using soap and water or alcohol-based sanitizers. Safe burial practices are essential to prevent further contamination. Bodies of individuals who have succumbed to Ebola must be handled and buried with strict precautions. This often involves trained burial teams following specific protocols. Environmental control measures focus on isolating infected individuals to prevent further transmission. Disinfection of contaminated surfaces and equipment is vital. Surveillance and contact tracing help monitor the spread of the virus and identify potential cases early on. Section 4. Fueling recovery. Dietary recommendations for Ebola survivors. Recovering from Ebola is a gradual process. A nutritious diet plays a crucial role in regaining strength, boosting the immune system, and replenishing lost nutrients. Hydration remains paramount throughout recovery. Drinking plenty of fluids such as water, clear broths, and oral rehydration solutions helps replace fluids lost due to diarrhea and vomiting. Coconut water is particularly beneficial as it is rich in electrolytes. Focus on consuming small, frequent meals rather than large, heavy ones. This can help with nausea and promote better digestion. Choose nutrient-rich foods that are easy to digest. Prioritize protein intake to support muscle repair and immune function. Good sources include lean meats, poultry, fish, beans, lentils, and eggs. Include fruits and vegetables in your diet for essential vitamins, minerals, and antioxidants. Consider incorporating supplements to address potential deficiencies. Vitamin A, vitamin C, zinc, and probiotics can aid in boosting immunity and gut health. Always consult with a healthcare professional before starting any new supplements. Section 5. Ebola, a shared responsibility of awareness and action. Ebola virus disease is a serious public health threat. However, through a combination of early detection, prompt medical care, and proactive prevention efforts, we can mitigate its impact. Awareness is key. Understanding the modes of transmission, symptoms, and preventive measures empowers individuals to protect themselves and their communities. Education and community engagement are crucial in dispelling misinformation and fostering responsible behavior. Immediate medical attention is paramount for anyone suspected of Ebola infection. Early diagnosis and supportive care significantly increase the chances of survival. Timely isolation prevents further spread and protects healthcare workers. Strict adherence to infection control measures is non-negotiable. Healthcare facilities must follow rigorous protocols for handling suspected cases. Proper use of PPE, disinfection procedures, and waste management are essential components of a comprehensive infection control strategy. A balanced diet and adequate hydration are vital for recovery. Nutritional support aids in restoring bodily functions and rebuilding strength. Supplements can address specific deficiencies and support overall well-being. The fight against Ebola requires a collective effort. Governments, healthcare organizations, and individuals must work together to enhance surveillance, strengthen healthcare systems, and promote responsible practices. Remember, knowledge is power. Staying informed and seeking professional medical advice are crucial steps in protecting ourselves and future generations from the threat of Ebola.